All right, knock, knock, knock. Good morning, Mariah. My name is Mackenzie, and I'm a student nurse from Columbia College of Nursing, and I'll be taking care of you this morning. So I'm going to begin by pulling the curtain and providing for privacy and shutting the door, which I already did. And then before I even start anything, I'm going to wash my hands, so I'm going to pretend to do that. So now I'm going to check your name band. All right, can you please give me your first name?
Mariah.
And last name?
Benzer.
And date of birth?
3/19/10.
Okay, good. All right, so can you, so this morning we're going to be completing a full body assessment. So is this going to be a good time to do that?
Yes.
All right. So, to begin, are you having any pain anywhere?
No.
Okay, and is your breathing okay?
Yeah.
Okay, if you had to rate your breathing on a scale of 1 to 10, like 10 being the worst and 1 being the best, what would you rate it on?
A 1.
Okay, that's good. Okay, so I'm going to ask you a couple of questions. So you already stated your name. Can you just tell me your name again?
Mariah.
Okay, and the date?
May 6th,
And what year is it?
2020.
And who is the president?
Donald Trump.
And where are you right now?
In the hospital.
Okay. All right, good. So the patient is alert and orientated ×4 to patient, place, time, and orientation. So I'm going to observe your appearance, behavior, posture, and hygiene. So your appearance to me looks appropriate, and your behavior is appropriate, and then your posture and hygiene are appropriate for the situation that you're in, being in the hospital. Okay, so that all seems normal. So I'm going to start out with your head and look at your pupils and your mouth. So I'm going to begin by turning the lights off. Okay. All right, good. So I'm going to have you turn your head towards me and look at the distance and look at the picture over there. And I'm going to be putting my hand on the middle of your nose, and then I'm going to be shining my light in both of your eyes, okay? All right. So check that eye. And that one. Okay, good. Did that hurt? Okay. Now what I'm going to have you do is I'm going to have you look at the tip of my pen, and I'm going to have you follow it as I bring it closer to your nose. Okay, good. All right, so your pupils are equal, round, and reactive to light and accommodation. Okay. So now we're going to inspect your external ocular structures. So I'm going to have you, I'm going to actually take a look at your eyelids. So this shouldn't hurt at all, but I'm going to, so your eyelids actually look like they're not swollen, they're not red, they look perfectly normal. So I'm going to look at the conjunctive. So I'm going to pull your lower lids down, and I'm going to have you look up. So, and this shouldn't hurt at all. Okay, so I'm not seeing any redness, any drainage, any swelling, anything like that. So that's good. And the sclera, which is like the white part around your eyes, that's white. It's not yellow or anything, so that's good. And then your eyes are symmetrical as well. Okay, so now we're going to assess the 6 points of gaze. So what I'm going to have you do is, are you comfortable laying down, or do you want to sit up a little bit?
I'm all set up a little bit.
Okay, so you can just sit up. And then you can, if you want to scooch back a little bit, you can. Okay. All right, so what I'm going to have you do is I'm going to be looking for involuntary shaking of the eyes. So I'm going to hold this pen about like a foot away from you. And I'm going to have you, without moving your head, I want you just to move your eyes and just have your eyes follow the pen. So I'm going to go in my upper right and the lower left and the upper left and the lower right, and then have you go side to side. Okay, good. All right, good. So we're looking for smooth motion of the eye, which is going to be a normal finding, which you do have a normal finding. Okay, so there are no signs of ptosis, so that's good. Okay, so next we're going to be looking at your mouth. So have you had any problems or sores or lesions or any pain like with your mouth, or any sores in your mouth, or any problems with your teeth when you're brushing them or anything?
No.
Okay. All right, so can you open your mouth and say ah for me? Okay, good. All right, so I'm going to check your skin integrity. So can you open your mouth one more time? I'm going to be checking inside. Put your tongue inside and open your mouth. Okay, good. So everything looks good in there. So next, I just have a quick question. So when you came in today, since we're going to be assessing your ears, when you came in today, did you come in wearing oxygen?
No, I didn't.
Okay, so if you did come in wearing oxygen, I would kind of just like pull up the back of your ears and check the bony prominences for any like any lesions, any scars, any like breakdown of the skin or anything. So it's good. So there isn't any because you didn't come in wearing it. So now I'm going to inspect the oral cavity again with my pen light. So I'm going to look at your lips. Okay, so your lips look pink and they're moist and I don't see any cracks or anything. So now we're going to look at your buccal membrane, which is the inside lining of your cheeks and your lips. So it's gonna be kind of hard because I don't have any gloves or anything, but just open your mouth. Open your mouth. Oh, say yeah. Okay, good. So I'm not seeing any like scars or any sores or anything in your mouth, so that's good. So next I'm gonna have you stick out your tongue. Okay, good. So what I'm seeing is the dorsal side of your tongue is rough and pink, and then I'm gonna have you stick your tongue like out and up. Okay, good. And the ventral side is shiny and I'm seeing veins, so that's a normal finding. That's good as well. So the subglossal area is pink and moist and there's no lesions in that area. And then next I'm going to look at your tonsils, which are all the way in the back of your mouth. So I'm going to have you open your mouth again and stick your tongue out. Open your mouth really big and stick your tongue out. Okay, good. I'm seeing that. And your tonsils are pink and they're not enlarged, so that's a good sign. And your teeth are white and in line. Okay, so now we're going to look at your gums to see if they're healthy and pink. So if you could just kind of put your lower lip. Okay, good. They're pink and they're healthy. Okay. Alright, so next we are going to assess your soft palate movement. So what I'm going to have you do is stick out your tongue and say ah. And I'm watching for your uvula to be moving. So open your mouth like really big. And stick your tongue back in. Open your mouth and stick your tongue out and say ah. Okay, good. So I'm looking for the back thing to be moving up and down. So that's good. Okay. So next, so that was all symmetrical and that's all good, and it did elevate, so that was like a good finding. So next I'm gonna actually have you lay down. Okay. Alright, so I'm gonna be looking at your neck veins. So I'm gonna actually take this pillow off from underneath you. And I'm gonna have you, don't hit your head. You're good?
Yeah.
Okay, so scooch down a little more. Okay. So, I'm gonna have you look away from me. And I'm gonna look for any pulsing going on in your neck. And like your neck veins. Okay, and I'm not seeing any. Okay, so next, I'm looking at your neck and I'm looking to make sure that it's symmetrical with your body and like proportional and all of that, so it is. And it is in line with your body, and I'm not seeing any visible goiter or enlarged thyroid, so that's good. Okay, so next we're actually going to be moving to the chair. Okay, alright, so now that you're sitting up in the chair, we're going to be palpating your lymph nodes in the head and the neck. So I'm going to be verbalizing the lymph nodes along with the palpation that I'm going to be doing. So if my videotaper could just come forward and it's going to be on the neck. Okay. All right. So the first one that I'm going to be doing is the pre-auricular. So that's, I'm going to be using my 3 fingers. Let me know if this hurts. It shouldn't hurt though. So that's going to be right here. And then I'm going to be doing the posterior auricular, which is going to be kind of like right here. And then I'm going to be doing the occipital, which is going to be like more behind the neck. And then we're going to be doing the submental, which is going to be like right below your chin. And then we're going to be doing the submandibular, which is going to be right here, like on the sides of your chin. And then we're going to be doing the cervical, which is going to be kind of like on the sides of your neck. And the last one's the supraclavicular, which is going to be like right above your clavicle, so kind of like going to be like in these spots right here. Okay, so now I'm going to be palpating your carotid pulse. So that's going to be more like right there. Okay, does that hurt at all? Okay, good. Okay, so we're going to actually just stay in this position if that's fine. And we're going to be auscultating for carotid brutes using the bell side of my stethoscope. So I'm going to have you take deep breaths in and out each time you feel my stethoscope move to a different spot. And I'm not going to be pushing hard or anything. It's going to be very gentle. And I'm going to make sure not to put too much pressure on your neck. Okay. All right. So it's kind of going to be like right here. And then like right here. And right down here. Okay. And you would have been taking deep breaths in and out as well. Okay. Are you still doing okay? Are you in any pain?
Yeah, I'm okay.
Okay. All right, so now I'm going to be assessing your cervical motion of the spine and cranial nerves. So I'm going to have you, this is the part where I'm going to have you try and turn your head against resistance. So don't let me turn your head, okay? Okay, okay, good. And now this one. Okay, good. Did that hurt?
No.
Okay, now what I'm going to do is I'm going to push down on your shoulders, and you're going to try to shrug your shoulders, okay? But I'm going to try to push them down, and you're going to shrug them against my resistance, okay? Ready? Go. Okay, good. Okay, so now I'm going to inspect the head and the face, so can you smile for me? And frown. Okay, good. So I'm not seeing any drooping or anything in your face, so that's good. If I did see drooping, I'd maybe be worried about like a stroke or something like that. So, and your face also looks symmetrical. So now I'm going to look at your head and your scalp, and I'm going to kind of run my fingers through your hair and check for any dandruff, masses, lesions, or anything like that. So I'm going to take your ponytail out. Okay. All right, so have you had any has your scalp been dry at all lately?
No.
Okay. Have you seen any flakes, white flakes or anything?
No.
Okay. So, not really feeling anything. Okay. Okay, that's good. Do you want to just leave your hair down until we're done?
Sure.
Okay. Okay, good. All right. So I'm not seeing any skin breakdown or anything in the back of the head. So now I'm going to palpate your head, including the maxillary sinus and the frontal sinus. So this shouldn't hurt at all. So the maxillary is going to be, I'm just going to kind of be pushing up. So the maxillary is going to be like here. Like that. And then the frontal sinus is going to be like here, kind of closer to your eyebrows. Okay, good. So now we're going to be assessing your cranial nerves. So I'm going to have you close your eyes. And I'm going to touch your forehead, your cheek, and your chin. And let me know if you can tell me where I'm touching, okay? All right, so where am I touching?
My cheek.
And where am I touching?
My forehead.
And now where am I touching?
My chin.
Okay, good. Okay, can you open your eyes back up? So can you smile for me? And frown. And wrinkle your forehead. Okay. And puff out your cheeks. And show your teeth. Good. And next, can you clench your teeth together? Like bite down? Good. So now I'm going to be putting my hands on the side of your jaws. And I'm going to have you move your jaw from side to side while I palpate the temporomandibular joint. So I'm going to be, tell me if this hurts at all. So I'm going to put my hands right here and clench down. Good. Now open your jaw and close it. And open and close. Good. And then open your mouth and move your jaw side to side. Your jaw. Like that. Okay, good. Okay. Okay, so now can you, so I wasn't seeing any crepitus, popping, clicking, or any range of motion limitations or anything, so you were able to do all of that just perfectly fine.
Don't move me.
So can you stick out your tongue? And can you move it side to side? Okay, good. All right, so now we're going to inspect and palpate the outer ear. So what I'm going to be doing is I'm going to be kind of pulling up on your ear lightly and palpating it, and I'm just gonna be moving it around a little bit. And I'm gonna feel for any like abnormal masses or lesions, and just let me know if there's any pain or tenderness when I'm doing this. Okay, so does this hurt at all?
No.
All right, is there any tenderness or anything?
No.
Okay, good. So now I'm going to look at the targus and palpate that. So it's gonna make this little bump right inside of your ear. Okay, good. And now I'm gonna palpate the mastoid process, which is the big hump behind your ear. Okay. When I touch this, does it hurt or anything, or is there any tenderness? Okay, good. Okay, so now I'm gonna be inspecting your nasal passages. So can you look up for me? Look up. Okay. I'm looking at your nose. Okay, good. Okay. So now what I'm gonna have you do is I'm gonna have you plug one nostril. And can you breathe in this nostril when you have that plugged? Okay, good. Now plug the other one. Okay, good. Can you breathe out of that one? Okay, good. All right, so now I'm going to pretend, so now we're actually going to be getting back into bed. Okay, so now that we're back in bed, what I'm going to have you do is lay in semi-Fowler's position to look at the pulsations. So I'm actually going to be taking the pillows out from underneath you. Okay. So good. Okay, so now I'm going to be looking at your arms. And I'm looking at your skin, and then after we're gonna be looking at your legs. Okay, so put your arms out straight, perfect. Okay, so I'm gonna check for hair distribution on your arms, and the hair distribution looks like they're both even bilaterally, so that's good. And now I'm gonna use the back of my hand and touch your arms to see if they're warm to touch, which they are, so that's good. And then next I'm gonna check for edema with my thumb. Okay, good, and there is 0 edema. And then next I'm going to be assessing color, and the color is both distributed even throughout, so that's good as well. Okay, so next we're going to be checking for your capillary refill time, so you have no nail polish on, so that's good. So what I'm going to be doing is just pressing on your nail, and it won't hurt at all. Okay, good, and your capillary refill time is less than 2 seconds, so that's good. Okay, so then now we're going to be assessing your strength. So what I'm going to have you do is I'm going to have you squeeze my fingers, and I'm going to try to pull them out, and don't let me pull them out. Okay, good. Now what I'm going to do is, now I'm going to have you try and pull up towards you. So, wait, was that how we did? Yeah, so pull up towards, good. Okay, good. All right, then now try to push my hands down. Okay, good. And then now I'm going to have you put your arms out and try and push up. Okay, good. And now try and push your arms down. Okay, good. Okay, and now we're going to finish assessing and rating the strength of your upper extremities. So I'm going to pull the blanket down. We're going to be going to her feet. Okay. All right, so what I'm going to do... Okay. So now what we're going to do is I'm going to be testing, or first I'm going to start by looking at the color. So the color is evenly distributed and bilaterally through both your legs. It's white and normal. I'm going to assess for temperature with the back of my hand. And the legs are warm to touch and temperature is even throughout, which is good. And then next we're going to be checking for edema with my thumb. And there is 0 edema. Okay. So next what we're going to do is we're going to check for capillary refill time in your toes. So I'm going to, since you have nail polish on, it might be a little bit hard, but I'm just going to push down on your toe and check for capillary refill time. And it is less than 2, so that's good. And now we're going to be testing your strength. So can you push down on my hands as if you were pushing on a gas pedal? Okay, good. And push my hands up as if you were pushing towards your nose. Okay, good. And now we're going to be checking your leg strength one at a time. So what I'm going to have you do is, can you, with this leg first, can you try and push your leg up, and my hand's going to be resisting? Okay, good. And now this one. Okay, good. All right. So now we're going to palpate your dorsal pedis and your posterior tibial pulses. So the dorsal one's going to be right up here. So let me just see if I can find it. Okay, so it's right there. And then your tibial pulse is going to be right over here, like kind of behind the bone over here on your ankle. Okay. Okay, good. Okay. All right, good. So your pulses are 3 and bounding. So what we're going to do is now we're going to finish checking your lower extremities. So I'm going to palpate and check your passive range of motion for inflammation, swelling, and crepitus. So we're going to check your ankle and your foot. So again, there is normal hair growth on both. And I'm not seeing any swelling, inflammation, or crepitus. And I'm not seeing any redness on the joints or anything like that. And have you been having any pain lately in your feet?
No.
Or in your ankles? Okay. So now we can cover you back up. While you're laying down, I'm actually going to have you sit up and turn around so that we can see your back.
Do you want me to come up?
And then turn all the way around. Okay. And then take your shirt off. Okay, and then Jane, you can come right here. Okay. Okay. So now what we are going to be doing is listening about 10 times in the back. So I'm going to need you to take easy, deep breaths in and out. And we're going to be listening to all 10 spots. So let me know if you get dizzy or if anything hurts or anything. So we're going to listen to 8. We're going to listen about 8 times down your back and then twice on each side. So, okay. Alright, so it's going to be right here. Okay, good. Okay, so now I'm going to inspect your skin on your posterior thorax, which is going to be back here between your scapula. Okay, so the skin seems to be even bilaterally throughout, like your whole back and everything. And I'm going to test the temperature, the back of my hand. So the temperature is warm to touch. Okay, good. Okay, so I'm not seeing any lesions or scars or anything. So I'm going to take a closer look at the bony prominences, and I'm going to inspect and palpate your spine. So what I'm going to have you do is sit up, which you're already doing, and I'm going to take a look at your spine. So, well, actually for this part, I'm going to have you stand. So what I'm going to have you do is stand up. Now I'm going to have you actually, I'm going to be checking your spine. So I'm going to look to make sure that your spine is symmetrical. So can you bend down and touch your toes? Okay, good. I'm looking to see if it's symmetrical right here, which it is. Okay, now stand up. And then can you kind of like lay to one side? Kind of like go a little more down. Okay, good. And now to the other side. Okay, good. So I'm not seeing any abnormalities or any skin folds. So next what we're going to do is I'm going to palpate your vertebrae. So Jane, I'm going to have you come closer.
All right.
Okay. So what I'm going to do is, so what I'm going to be doing here, just come a little closer. Okay. So I'm going to be palpating your vertebrae. So that's going to be like right down the middle. Does that hurt at all?
No.
Okay. All right. Are you still doing okay?
Yep.
Okay. And then next I'm going to palpate the paraspinal muscles for tenderness. So that's going to be like right here. Does that hurt?
No.
Okay, good. And then now we're gonna percuss your back and the costovertebral angle for tenderness bilaterally. So that's going to be like right in here. And how does that feel? Good. Okay, good. All right, so now you can actually lay back down in bed and we'll cover you up. Alright, so now that we're back laying down, what we're going to do is we're going to be checking and inspecting your skin throughout your anterior thorax. Alright, so I'm not seeing any like skin changes or lesions or scars or anything like that. And the skin's intact. So that's good. So next we're going to inspect your anterior thorax shape and configuration. So let's see, so the thorax is symmetrical, so that's good. Okay. Alright, so now we're going to assess the use of your accessory muscles on your anterior thorax. So what I'm going to have you do is I'm going to have you actually sit up and then turn so the camera can see you. And I'm going to have you, turn this way. And I'm going to have you take a deep breath in. Like, kind of put your arm, okay, like that. Okay, so take a deep breath in. Deep breath. And now exhale. Okay, good. So what we're looking for is we're looking at your chest to see if it increased when you were breathing, which it did. Okay, so next we're going to auscultate your breath sounds on your anterior thorax. So you can turn back down and lay back down. Okay, so now I'm going to listen to the front of your lungs. And we're going to be listening in 6 different spots. So, alright. So we're going to be listening right here. Take a deep breath in. And exhale. And right here. 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 Okay, good. Alright, so next what we're going to do is we're going to listen to your heart. And when I'm listening to your heart, I'm going to be naming the 5 spots that we're going to be listening to. So with that, well, first we're actually going to be listening to your heart with the bigger side of my stethoscope. And then after we'll be listening with the bell side of my stethoscope, and that's when I'll be naming all the spots. Okay, so what we're going to be doing is we're going to be listening right here. Or I'm sorry, right here. Right here. Right here. And then this one has to kind of go under your sports bra a little. Right here. And then right here. Okay, good. So now we're going to do that. So now we're going to listen to the right middle lobe of your anterior thorax, which is kind of going to be like on the right side, like in the middle of your lung. So like it's going to be like right here. Well, your right side would be right here. Okay, good. Okay. So now what we're going to do is, now we will do that again with the bell side of my stethoscope, listening for any murmurs or any other heart sounds. So it's going to be the same thing, but with the smaller side of the stethoscope, so it shouldn't hurt or anything. I'm going to have you take deep breaths in and out again. So it's going to be right here, right here, right here, and then right here. And this one is right here. Okay, good. Alright, so the last thing that we're going to do for this part is we're going to look at the abdomen. So what I'm going to do is I'm going to lower the head of the bed all the way down. So I'm going to be moving these pillows. Okay. So I just have a few questions before we start. So when was your last bowel movement?
Yesterday.
Okay. And do you have any problem urinating?
No.
Okay. Alright, so you have your shirt off and everything, so that's good. So what we're going to do is I'm actually going to be listening with my stethoscope to your abdomen. And then after I'm going to be palpating your abdomen. Okay, so I'm going to listen right here. Right here. Right here. And right here. Okay, good. Alright, so realistically we would have listened to all those sounds for a full minute. But the bowel sounds were present and they were normal active, so that's good. Have you had any pain in your abdomen?
No.
Okay. Alright, so now what we're going to do is we're going to inspect your abdomen. So I'm just looking to make sure that the color is even throughout, which it is, so it's white. There's just like a little birthmark right there, which is fine. And then now I'm going to test the temperature with the back of my hand. And it is warm to touch, which is normal. And I'm not seeing any striae, any lesions, any scars, or anything like that. So now I'm going to get down at eye level, and I'm going to look to see that your abdomen is I'm going to look to see if it's like symmetrical, and it is. And it looks like your abdomen is flat, so that's good. And I'm not seeing any peristaltic waves or anything. Okay, so next what I would do is I would wash my hands. And now what we're going to do is we're going to palpate your lower abdomen. So let me know if this hurts at all, okay? I'm just going to be kind of pushing a little bit on your abdomen. So I'm going to be pressing like right here. Right here. Does this hurt?
No.
Okay, good. Okay. So now what we're going to do is we're going to assess your deep tendon reflex. So can you sit up for me? Okay. So we're going to be, so I need to get, where did that cone go? Okay. So what we're going to be doing is I'm going to have you lift up your arm and just kind of like relax it. Okay, so we're going to be testing for your biceps reflex. So what I'm going to do is just kind of like relax your arm, and I'm finding where where I can feel the tendon right there. So what I'm going to do is just relax it. Okay. So I'm just going to be checking for a reflex. It's going to be kind of hard to properly check for the reflex since I don't have the right tool or anything, but that's how we would do that. Okay. So next what we're going to be doing is we're going to be checking your patellar reflex. So what I'm going to have you do in a minute is move to a chair and sit on the edge of the chair, and then I'll be checking your reflex with that. So, alright, so next we're going to assess your patellar reflex. So I'm going to have you sit on the chair like you're doing, and then I'm going to be using my stethoscope to be testing that. So, does that hurt?
No.
Okay, good. Alright, so now what we're going to be doing is we're going to be assessing your neurosensory of all four extremities. So the technique that we're going to be using is the light touch technique. So this is going to be assessing your cerebral function and coordination. So what I'm going to have you do is, can you touch your finger to your nose? Okay, good. So the last thing that we're going to be doing today is your gait and station. So we're actually going to be going to the living room so that there's a better spot to walk for you to do this. So we'll go. Okay, so now we're going to have you do a barefoot gait. So can you walk on your bare feet as you normally would? That's running.
I just came over here to
Okay, go.
start walking.
Okay, good, and walk back. Okay, good. So now we're going to have you do the tandem walk, meaning can you walk on your heels? Okay, alright, now can you, okay, good. Alright, so now can you walk on your tippy toes? Okay, and go back. Okay, good. Well, and actually, can you walk heel to toe?
What do you mean?
Like touching your heel to your toe when you're walking. Okay, good, stop. Okay, so now we're going to be doing the Romberg test. So that's going to be, so I'm going to have you come stand in front of me. And then, actually back up a little bit. Okay, and cross your arms across your body. Okay, and open your eyes. Okay, good. So we're just going to test if you can stay straight. Okay, now close your eyes. Okay, do you kind of feel like you're swaying back and forth?
Mm-hmm.
Okay. All right, good. Okay, so that all looks normal, and I was not seeing any swaying back and forth besides when your eyes were shut. All right, so now we can go back into bed. Now we're back into bed. What I'm going to do is I'm going to lower your bed into the lowest position. I'm going to make sure that your side rails are up so that you're safe. I'm going to make sure that your bed is locked, and I'm going to give you your call light, which is right here. So if you need anything, don't hesitate to call me. And then just a couple questions before I go. Are you in any pain?
No.
Okay. Are you comfortable at the moment?
Yes.
Do you need any of your personal belongings with you?
No.
Okay. All right, so I made sure that all my equipment is working and that the environment is clean. And the last thing I would do is wash my hands, document my findings, and then tell her to have a great day and everything. But there are a few things that I would need to mention that I did forget to do throughout my scenario. So I did forget to compare the pulses bilaterally. And then also when I was auscultating the abdomen with the bell side of my stethoscope, I forgot to mention the points that I was auscultating. So I can just quickly, I can just quickly do what I would have done. So if my stethoscope was on, I would have, this would have been the first point. The first point would have been the aortic, and then pulmonic, and then Erb's point, tricuspid, and mitral, right there. Okay, all right, you have a good day, thank you.
You too. Thank you. Bye.